Can you hear me now? Thank you for letting me know. I was muted on YouTube. See, this is why this is good. You guys, I hope you guys can hear me now. Let me know if you guys can. Okay, perfect. And I am literally like in my living room on the floor, basically. So, all right. So, the way that I wanted to do this is I wanted to show you guys the questions. So, on Instagram, I have like two cameras. So, I will be going over the questions or actually showing you a picture, not a picture, video of the question. And then we'll go over the answer together. So, are we RNs or, I mean, are we studying for the Nclex RN or LPN? Just let me know so that way we can choose which one we want to do. Okay. Oh, hi, Erica. Thanks for joining. This is me trying this out. Are you planning to go in nursing school? Might as well let's have a conversation since we don't have many people joining yet. Or are you just thinking that you want to do nursing, or you know you're gonna do nursing? Oh, you're an LPN. Yeah, LVN. I know some places it's LPN, other places it's LVN. Um, awesome. That's amazing. And then you want to go into RN? Okay, got it. Yeah, that's the same thing that I did. I was an LPN first, and then I went into RN, and then I kept going, got my master's, and now I'm already thinking about what I'm gonna do next. So I'm the worst. Okay, I'm looking on Instagram to see who else is connecting. You know what? Like, even if not a lot of people connects to this, like I just need engagement. I need views, especially on YouTube because I'm almost getting monetized, and I just need this, more videos, more people viewing my content. Just a little bit. I'm almost there. So that's why I decided to do this. I was like, oh, it could be a good way to like have fun, do something different, and get monetized. Hopefully. Let's see. Thank you. I appreciate you. I really do. So, I mean, even if you're not there yet, it's good to go over questions, because once you do get to go there, then you'll be like, I got this. I know what I'm doing. Like, I remember this from when I watched that video or that live with Nurse Nali. Yeah, see, right? How about over here on Instagram? Anyone really in nursing school or LPN, RN, anything? I know I'm already celebrating Christmas over here. Hasn't been Thanksgiving yet, but I'm celebrating Christmas. ah, yeah, that's the Puerto Rican in me. I love me some Christmas. All right, I wanted more people to connect to here because like the point of this whole thing is for you guys to kind of like try to guess um the answers. So I'll show you a question and I'll read the question and then the answers and you guys have to try to like guess the answer. And then we'll go over the answer and the rationale. Is there anyone else connected on Instagram? If no one really connects to Instagram, like, well, there's a couple. I will just maybe use the second camera to YouTube so you guys can also see the video, the questions. Do you hear me twice or is it just me? Like I hear an echo. Enjoy. All right. I have two people join here. Right, there is an echo? Okay, thank you. Because I'm like, is it me? Okay, you do hear an echo. I hear it too. I'm like, is this is so annoying. But are you able to like understand what I'm saying or hear me okay? I know it's because I have the phone and it's creating an echo. It's not that bad. Okay. All right. So I don't know. Let's just go over a couple of questions because I'm only gonna be here for like half an hour. Do you guys want to? Well, you say you're an LPN already, so let's go with just RN questions, right? And you know what? To tell you the truth, it's pretty much the same thing. LPN, RN. When I took my NCLEX, they were literally both the same thing. You just have to remember, you know, your title. You just have to remember, okay, I'm an LPN. I know I cannot assess, I can inform the RN, like see things, right? And inform, but you don't really assess. You know, the RN is the one that assess. So you just have to remember those little tricks. Other than that, everything else is literally the same. Like nothing changes. Like there's not a big change from like when I was an OPN to an RN when it comes to like learning the information because it's all the same. The body doesn't change. Everything that you learn in LPN school goes for RN school. It's the same thing. All right, guys, let's go over. Let's do a couple of like fundamentals. Fundamentals is usually, I mean, it's what it says, right? The name fundamentals. It's like the beginning and the phases of nursing. So it goes over the. I'm sorry, I'm trying to look for a page. Oh, all right. Let's see. I haven't been in school since. Let's see what if I remember anything, right? Literally. And then when you work at a place for so long, that's all you know. And it's crazy because nursing is so like broad. Like there's so many things that you can learn in nursing, but at the same time, once you go into just one specific field, that's what your brain will just focus on. Yeah, there's a lot of things I don't remember. There's a lot of things that I don't really, you know, I don't practice as a nurse. So as a nurse, like there's certain things that you do want to remember. There's certain things that you will always remember, would never forget. But there are things that your brain just says, I don't need this, like this is not what I'm doing right now. I don't need it right now. So you just kind of like put it in the back burner. In 2014, that's when you got your LPN. I got mine's 2015, so pretty much the same. Hey everyone. Uh, okay, so a couple of more people joined on Instagram. There's a couple of more people here on uh, YouTube. So I just want to like say it again. I am actually live on Instagram and on YouTube. So I'm live on both sides. I know I there's an echo going around. I'm sorry. I can't help it. I don't know how to fix that. And that's because I'm going to use my like a second phone as a camera so we can look at the questions in Instagram. Okay. But I need to be live on both sides. The reason being is I already explained it before, but if you're just got here, I'm almost monetized on after almost 3 years. I'm almost monetized in YouTube, and I'm trying to just do this because doing lives literally gives you like a lot of hours. Even if I open up a live and nobody joins it, I get a whole bunch of hours. So if you're thinking of opening a YouTube channel, that's just letting you know. So that's why I was like, you know what? Let me just do that live. All right. So let's do fundamentals. I wanted to see if a couple of more people would join, but that's fine. I'm going to go over nutrition. Let's do nutrition. Let's see what we can do. Let's get a good question. Who loves select all that applies? I don't think anyone will say I love those. Those are the worst questions. You get one wrong, you get the whole freaking question wrong. So that was like the worst. So let's go over. These questions are long. I didn't want to do a long one, but here we go. Let's do this one. All right, let's do number 81. Yeah, right here. Let's see if this will focus. Is it focusing? Oh, there we go. So the questions reads, a client with hypertension has been told to maintain a diet low in sodium. The nurse who is teaching this client about foods that are allowed should include which food item in a list provided to the client. What foods low in sodium? Tomato salt, I'm sorry, tomato soup. Oh, sorry. Tomato soup is the first one. Two, boiled shrimp. Third one is instant oatmeal. And the fourth one is summer squash. Tomato soup, boiled shrimp, instant oatmeal, and summer squash. What is your final answer? All right, let me just keep it there for a little bit. What do you think? Low in sodium. Is it tomato soup, boiled shrimp, instant oatmeal, or summer squash? Come on, it's okay. You can just say whatever you think it may be. All right. 1, 2, 3, or 4? All right, I got a summer squash. Anyone over here? You're just here for fun. It's okay. Literally, there is a wrong answer, but there's no wrong answers here. You could just say whatever you want. Like even if it's wrong, it's okay. You're good. Um, I'm thinking the summer squash too. I'm thinking 4 too. I didn't look up these questions before, like the answers. I'm just choosing whatever. And who knows? Maybe that's not it. Maybe that's not the answer, but that's what I'm thinking. Maybe. I thought about the instant oatmeal, but instant oatmeal is they add all these extra things. Like we think it's good, but it's not. The squash is natural, right? So, all right, let's go see the answer. The answer is wait. Yes, ding ding ding. You guys were right. Summer squash. So 4. Foods that are low in sodium include, I don't know if you guys can see it. All right, include fruits and vegetables. Summer squash is a vegetable, so that was an easy one, right? All right, let's do something more different. What time is it? I'm gonna be here for a couple of more minutes, so let's do, oh no, we're not doing this. All right, let's do fundamentals again. Let's do a different category, growth and development. That's a good one. Growth and development. And Graciela, are you going into nursing school or something, or are you just here for fun? I know you do dental assistant, right? Let me know. I'm interested now. Who's over here? Summer squash. Okay. So let's do this one. So growth and development is the category. Growth and development. We're gonna do 207. Let me just get this in. All right, so it says, let me read it from here so I don't. All right, 207. That's the one we're doing Instagram. The nurse is describing Piaget's cognitive developmental theory to pediatric nursing staff. The nurse should tell the staff that which child behavior is. Sorry, I'm trying to look through here and it's just a mess. behavior is characteristic of the formal operations stage. One, which is the child has the ability to think abstractly. Two, the child begins to understand the environment. Three, the child is able to classify orders and sort facts. And four is the child learns to think in terms of and present, past, present, and future. So one, two, three, four. I don't know, tell you the truth. The nurse is describing Piaget's cognitive developmental theory. I remember that theory. I just can't recall exactly. All right. Oh, sorry. Instagram, you guys can read it for a couple of more times. YouTube, I'm sorry, I don't have another video for you guys. I need to coordinate that for you guys. The child has the ability to think. Piaget. All right, what are you guys thinking? The child has the ability to think abstractly. The child begins to understand the environment. The child is able to classify, order, and sort facts, or the child learns to think in terms of past, present, and future. Cognitive developmental theory. You're thinking two? I don't know. Tell you the truth. Two is the child begins to understand the environment. It could be cognitive mental. Learns to think in terms of past, present. I don't know. For some reason, I was thinking four. Child has the ability to think abstractly. I don't know. I was thinking four. Oh, you're thinking four, and I got a two over here. I don't know. For some reason, I'm thinking four. Maybe I'm wrong. Me. I don't know. I don't work. Well, sorry, my dog. I am a school nurse, but I have to deal with all of this, so like that. So I don't know. Sorry, forget my dog. He's barking at my husband. Max, Maxie. I don't know why he's barking at him. He lives here. You would think he doesn't live here. We were Max. Maxie, come here. It's because you're bringing stuff from outside. This is live. See? Maxie, come here. Come. What's wrong with you? This is a drama. This is a drama. Like, I don't get it. You would think, like, why are you even barking? Like, what are you gonna do? He's not doing anything. He just wants to bark for no reason. Like, if he's gonna bite anyone. Yeah, right, Maxie. Maybe I'm making yeah. No, we were all thank you. We were all wrong. Oh my goodness. Max, stop it. If now you're gonna have to go on your crate. It was actually 207. It was actually one. Max. Maxie. Carla, just put them in the crate. This is fun. So yeah, definitely I'm not doing this twice a week. This was a tryout. This is not working very well. And I don't have my kids here right now, but I have a dog. All right. So it was actually one. One says the child has the ability to think abstractly. I didn't think it was that one. And let me show you the rationale on that. In the formal operation stage, the child has the ability to think abstractly and logically. Option 2 identifies the sensory motor stage. Option 3 identifies the concrete operational stage. And option 4 identifies the pre-operational stage. Yeah. All right. Next. Let's do. I'm just gonna jump over to maternity. Let's see if I remember maternity since I worked at an OBGYN office for 6 years. Let's see. Let's see what I remember from there. Okay. Let's do 317. 317. Let me make it clear. Can you guys see? Okay. It says the nurse is creating a plan of care for a postpartum client with a small vulvar hematoma. The nurse should include which specific action during the first 12 hours after delivery. 1. Encourage. Max, put him in the crate. Yeah. Okay, I'm so sorry. This is a mess. Hold on, let me put him in the crate. I can't. I'm like, okay, the kids are not bothering, so it's gonna be fine. Yep, the kids are not here, but the dog is here. Okay, let's try this again. The answers are encourage ambulation hourly. Did I even finish the? Let me read the whole thing. I don't remember finishing it. The nurse is creating a plan of care for a postpartum client with a small vulvar hematoma. The nurse should include which specific action during the first 12 hours after delivery. The first 12 hours after delivery. 1. Encourage ambulation hourly. 2. Assess vital signs every 4 hours. 3. Measure fundal height every 4 hours. 4. Prepare an ice pack for application to the area. So the nurse is creating a plan of care for postpartum client with a small vulvar hematoma. The nurse should include which specific action during the first 12 hours after delivery. All right, 1, 2, 3, 4. I don't think it's 1. It's vital signs every 4 hours. I don't think it's 2. Either 3 or 4. I'm thinking 4. It's either 3 or 4. But to me, I don't know. What do you guys think? I was thinking in between 3 or 4. Let me know what you guys think. I got a 4 over here. Anyone over here? What do you guys think? This is a mess. And I'm getting hot. This dog is getting me hot. All right. So a 4. I said either 3 or 4. I guess I have to do a final. Choose one, right? Measure fundal height every 4 hours or prepare an ice pack for application to the area. Yeah, I'm thinking 4 too. All right, let's see. So that was 317. The answer is 4. We got it right. It's 4. The hematoma is localized collection. It's a localized collection of blood in the tissue of the reproductive sac after delivery. Vulvar hematoma is the most common application of ice reduces swelling caused by hematoma formation in the vulvar area. Yep. We got it right. Good. Let's do another maternity. I like maternity. All right. Let's do this one. 313. Let me see. All right. Let's do this one right here. Oh, wait. 313 is not here. Can you guys see it? Let me see it. No, maybe I move it here. The light, it's more that way. All right. It says, let me wait for it to focus. Okay. The nurse is assessing a client in the fourth stage of labor and notes that the fundus is firm, but that bleeding is excessive. So it's firm, but bleeding is excessive, which should be the initial nursing action. 1, record the findings. 2, massage the fundus. 3, notify the healthcare provider. And 4, place the client in Trendelenburg's position. What do you guys think? 1, 2, 3, 4. 1, 2, 3, or 4. The nurse is assessing a client in the fourth stage of labor and notes that the fundus is firm, but that bleeding is excessive, which should be the initial nursing action. The fourth stage of labor. Massage the fundus. 1, record the findings. 2, massage the fundus. 3, notify the healthcare provider. And 4, place the client on Dellensburg position. What are you guys thinking? I got a 4 over here. Anything over here? No. All right. So, I don't know. I'm thinking you said 4, place the client in Transdellenberg's position. Notify the healthcare provider. We got a 3 or 4. Notify the healthcare provider. Is assessing a client in the fourth stage of labor. I, for some reason, want to say 2. So I'm going to go with 2. I don't know why I want to say 2. Because I'm thinking the fourth stage, isn't that like after? I don't know. Let's see. The answer is, what did I say? I was wrong. The answer is 3. Notify the provider. What does that mean? Let me see. What is the fourth stage? Because that's what got me confused. So this is the answer in the rationale. So if bleeding, excessive bleeding. So if bleeding is excessive, the cause may be laceration of the cervix or birth canal. Massaging the fundus, if it is firm, would not assist in controlling the bleeding. I was thinking maybe after. Trendelenburg's position should be avoided because it may interfere with cardiac and respiratory functions. Although the nurse would record the findings, the initial nursing action will be to notify the healthcare provider. Yeah, that makes sense. She's bleeding excessively, so the first thing that we should do is let the doctor know. Oh yeah, girl, we're all guessing. I'm guessing too, you saw. Don't feel bad. Any answer, it's just for fun. It's just to kind of like get an idea and just kind of like, remember, because see, I have 6 years of OBGYN and I still got a question run. So don't feel bad. We got this. We're just playing around and kind of like going over questions. All right, let's jump to, should we do pediatrics? We already did a pediatric. I'm just going to do one more because I was just going to be here for half an hour. Last one. We're going to do adult. Do you prefer any system in an adult? We have respiratory system, cardiovascular, urinary, eye or ears, neurological, or musculoskeletal? Do you guys have any preference? No? Any? I'll choose cardio. All right, let's try that. Let's try cardio. Okay, here we go. That, I don't know. I would definitely not be the best one. All right, let's see. I'm gonna choose a short one. Client, let me see. I think I already put this one. Okay. So let's do. All right, let's do this one. It's not short. They're all long. All right, let's do 667. Is this one right here? So it says a client in sinus bradycardia, with a heart rate of 45 beats per minute, complains of dizziness, and has a blood pressure of 82/60. Which prescription should the nurse anticipate will be prescribed? One, administer digoxin. Two, defibrillate the client. Three, continue to monitor the client. Or four, prepare for transcutaneous pacing. One, two, three, four. Mr. Digoxin. Digoxin. I don't know. Is that for defibrillate the client? I mean, heart rate 45, blood pressure is 82/60. What do you guys think? One, two, three, four. Minister Jackson is one. Two is defibrillate the client. Three is continue to monitor the client. Or four, prepare for transcutaneous pacing. Transcutaneous pacing. I don't remember what that was. Okay. What we got? We got a three over here. Let's continue to monitor the client. I don't know. I'm in between one or four for some reason. I don't know. But what do you guys think over here? I'm not sure in this one. Just guess one. Which one would you think if you were to give me a guess? The client is in sinus bradycardia, so it's low, with a heart rate of 45 beats per minute, complains of dizziness, and has a blood pressure of 82/60, which is pretty low. Which prescription, that's what it's saying, should the nurse anticipate will be prescribed? Administer digoxin, defibrillate the client, or continue to monitor the client, or prepare for transcutaneous pacing. I don't remember what was transcutaneous pacing. So let's see. We got a three over there, and you want to try one? I was thinking one, two, because digoxin is something for the heart, but I don't remember exactly what it does. I am going to go with prepare for transcutaneous pacing. I'm just going to go with four. I don't know. Let's just all have a different one. 3, 1, 4. The answer is, which one was it? 667. 667. Oh, I got it right. 4. What did I say? Did I say 4? No, I don't know. Did I? I think I did. Prepare for transcutaneous pacing. I just don't know what it is. Fibrillate the client. Yeah, so it is 4. So it is prepare for transcutaneous pacing. 667. Let me show you the rationale. So sinus bradycardia is noted with a heart rate less than 60 beats per minute. This rhythm becomes a concern when the client becomes symptomatic. Hypotension and dizziness are signs of decreased cardiac output. Transcutaneous pacing provides a temporary measure to increase the heart rate and thus perfusion in the symptomatic client. Defibrillation is used for treatment of pulseless, yeah, ventricular tachycardia, and digoxin will further decrease the client's heart rate. Okay, digoxin is actually to decrease the heart rate. Continue to monitor the client delays necessary intervention. So it was 4. All right, guys, I am done. Thank you for being here. Um, I'm not sure this will happen again. Like, I'm not sure if I'm going to do this again. If I go live here, it may be just for just to chill, have questions, but I don't think this is it. I liked it. It was okay. It's just there's too much going on. Yeah. But hi. I am good. How are you? I am done actually. We're done with whatever is going on here right now. But guys, if you guys have any question nursing related, I'm going to open the floor for like a couple of minutes. If you guys want to ask any question related to nursing school, the Nclex, nursing, nurse life, anything nursing related, feel free to just ask before I just shut everything off. You have holiday decorations already. Yep. We already went over that. You're a little late to the party. But yeah, we already went over that. I'm already celebrating Christmas. And I said that's the Puerto Rican in me. Like literally November. Was it November? No, not even. Actually before Halloween, because I don't celebrate Halloween, so I don't care about it. So before Halloween, this bad boy was already there. So yes, I am celebrating already Christmas. My bad. I'll watch the replay. No, it's okay. I'm just being sarcastic. I'm just playing around. But yeah, so we were just going over Nclex questions. We literally did like 4, I think, because a lot happened. I don't know if I want. Well, yeah, I'm gonna have to keep the video, but the replay. If you want to watch the replay, feel free. But it was really like a mess. So I don't think this is gonna happen again because my dog started barking and everything got crazy. So it was just a lot going on. But if you want to laugh a little bit, yeah, you're feel free to watch the replay. You're gonna enjoy it. Do you guys have any other questions or anything? I know I do this a lot on my YouTube channel, like where I just literally just open up the floor to ask questions, and I usually get a lot of questions about nursing and all these things, and about like the master's degree. When I got my RN through Excelsior's, I used to get a lot of questions about that. Um, yeah. Okay, I'll check it out. All right. Feel free at your own risk. But yeah, so we'll see. I may tweak a little things in my Instagram because I said I was gonna do this twice a week. Yeah, I don't see that happening. I may do it once a month, maybe, maybe. All right, guys. If any of you guys are in nursing school or getting your master's degree, I will be. Well, I have a stand store that I recently created. I am selling all my assignments there. The assignments for the master's degree, obviously, you cannot use my assignments because that's plagiarism, that's illegal. But you can use them as a guide. You can use them as a way to see, oh, this is how the paper should look like. This is what will get me an A and to pass. Because all my papers had to be an A in order to pass. So if it wasn't an A, I wasn't going to be able to keep going. So if that interests you, you're welcome to go check that out. It's on my stand store. Literally, I think I'll add it here somewhere. I think I have already added it in my Instagram, but you can also check it out here. I think I have it on my YouTube. If not, I'll add the link. It's stand store dash Nurse Lally, I think. So if you're interested in that, I'm also selling other digital items. So if you're interested in that, I also what else? I'm also doing one-on-one coaching. So if you're interested also in doing something like that to go over like starting nursing school or like any questions you may have about nursing related, based on my knowledge or my history. Like I said, I was an LPN first, and I went into um, RN school through Excelsior College. Then I did my master's degree in Capella University. So if you're interested in knowing about the process and all that fun stuff, I'm your girl. Okay. So that's pretty much it, guys. I hope you guys enjoyed this. And I hope you guys stay tuned and continue to watch my videos. I will see you guys on my next one. Bye. All right, let's end this right here.